Just kind of as an introduction, several months ago, we had Peter Davies come down to our office, and the main topic of conversation that we wanted to discuss was talking about antibiotic use measurement, and so showing him our system of how we measure antibiotic use within Iowa Select Farms, how we document our treatments. Also discuss about how we're going to put together some metrics on our usage, how we benchmark internally, and then also, as he's got his project going, how we can collaborate with him on sharing our data with him. And so in between the time we had set up that meeting and the time he came down, we started talking about, or that paper had come out talking about the carbapenem-resistant Enterobacter. And there had been some discussion or some within ASV and Pork Board and NPPC. We had a call, and there was definitely some divergence, I would say, within some members about mass injection of antibiotics and how do you define that as either treatment, control, or prevention. And also, probably the use now with some of the new guidance and production uses being limited, a lot of discussion around prevention uses of antibiotics are going to be kind of the next target. So we wanted to have a discussion with him about that on some of the ways that we would use mass injection of antibiotics in our system and his thought process. And he challenged us back to say, we need to make sure that, I think the key things that I took away were we had veterinary decision-making and veterinary oversight. We documented that we had a need to use it and the way we were using it. There was a benefit to how we were using it, and then we had some kind of mechanism to continuously evaluate whether that use was still needed or how we went about thinking about that. So that's kind of what I put together in talking about kind of some of the main points of this talk, is talking a little bit about our veterinary oversight and how we would justify uses in our system. And then kind of a couple main ways that we use antibiotics, or the antibiotics may be used pretty commonly in industry. And so I know one common use would be antibiotic administration around day one of a pig's life or processing time frame to help with infections that occur around that time. And really thinking about that in terms of control, prevention, treatment. Because when you think about, so for example, that paper that came out on the carbapenem-resistant Enterobacter, that was an antibiotic injection to all the male pigs at the time of castration. And so, as a truly framed as a preventive use of antibiotics. And also, there's been some discussion about what is, which products can use in that way. And so I'll talk a little bit about that. And then also sometimes when groups of pigs or flows of pigs are sick, you might use a routine injection of antibiotic at weaning or prior to weaning time for a period of time to get them through a health challenge time period. So talk about what that looks like in our system, and then just a little bit, just to kind of round up what might be, the full spectrum of when we would mass inject a group of pigs with antibiotic. Talk a little bit about growing pigs post-weaning. So when you think about, I guess the antibiotics that I'm going to focus on that we use in our system would be some of those that we just talked about being highly important or critically important for human health. So Exceed, Draxxin, Baytril, so the macrolide, cephalosporin, and fluoroquinolone type class of antibiotics. And so when you think about what's on the label for those drugs, for example, ceftiofur, that's labeled for control and treatment of respiratory disease in swine associated with certain pathogens. And that drug, it's only legal to use that drug off-label for different indications of use. It's not legal to use it at a different duration, to use it for a preventative measure. It's okay to use it for control and treatment, and you can use it for other pathogens or other indications. With fluoroquinolones, there's really no flexibility. It's labeled for treatment and control of certain swine pathogens, respiratory pathogens, and then also as a secondary option for E. coli treatments. And then Draxxin would be, again, or 2-lathromycin as a macrolide would be okay to use, or it's labeled for control and treatment of swine respiratory pathogens. And then, as far as I know, really, there's not restrictions in terms of off-label use of that drug in particular. So as we think about that in context of our veterinary service team, we've got 5 members. So Shamus Brown, I see him sitting in here, Cassandra Jass, Lynn Pavlovic, and Katie Wadle. And so what we do within Iowa Select Farms, our team oversees multiplication and boar studs, our production well-being, our animal well-being team, our PCR lab, and then all of our commercial sow farms and commercial finishing pigs. And so as those duties are split up amongst us, we help out with each other. There's a lot of crossover. And it's important for all of us to be informed of what's going on in all of our pig flows because we may have different finishing regions. However, most of our pig flows are going to be placed into those different regions. They're not a straight line flow where these sow farms only go to this finishing region. And so for both our veterinary team and our production staff, it's important that everybody knows what's going on, is engaged with what's going on at the sow farms and our trends in wean to finish health. And then also, as an extension of our veterinary team, our production guys are really well versed at giving us clinical data on what they're seeing with the pigs, posting pigs, sending us pictures, also a lot of times collecting samples. So they really serve an extension of our team as well. One thing that we've put in place, I think, has helped a lot. We try to get into every group of pigs placed in nursery or wean to finish within this first 6 weeks of placement. So gives us a good idea of what's going on with the pigs. We do designate some flows as challenge flows based off what's going on at the farm, and those ones would often be, might be a group that we're using a mass injection and weaning on for a period of time. And so those ones a lot of times we'll get in at least twice within the first 6 weeks. And our production staff will be in every group weekly, and those challenge flows oftentimes twice a week for the first few weeks as those pigs get started. So we do have a lot of oversight of those groups as they start and they're sick, not only from a VFD standpoint, but also continue to analyze, if we're doing a wean pig shot, what do we think about that? And it really allows for a lot of communication and feedback within the group too. We also go to every sow farm at a minimum of every 60 days to make sure we're engaged with what's going on at the farm, getting a good clinical picture. A lot of times if there is something going on, it will be more frequent. And then every Monday morning we have a meeting with production staff and veterinarian team to talk about what's been going on for the past week, to discuss those challenge flows, reevaluate what we're doing. A lot of times that's when we'll make decisions based off everybody's input on if we're going to decide to do a treatment on a group of pigs or pull a treatment back that we no longer feel we need. One way that we document communication, we have a nice internal web page that allows for a lot of communication, not only on treatments, mortality trends. Everything's entered in daily, so we can even look to the site how many treatments they gave that day, how many pigs they lost that day, but also all of our visits go on here. So I just pulled up one from a site I was at recently, and you can see somebody can click on that hyperlink and see what my notes were from that visit, and I can go and look at all the production visits to that site as well. And it also allows, any of our veterinary team, any of our production team, okay, I'm going to be placing this set of pigs. I can go look and see what everybody else has said about how they're doing, and allow for some, real easy communication in addition to the verbal in the meeting we do. So the first one I want to talk about a little bit is antibiotic injection on day one and processing or at processing time. And so the reasons why people do this in the industry are pretty obvious, but number one, to reduce, control infections of the navel cord. And so a lot of times those umbilical infections will lead to systemic infections, which are detrimental, obviously, to the health of the animal. And then also with umbilical hernias. So the higher prevalence you have of umbilical infections have been demonstrated to also have higher prevalence of umbilical hernias downstream. Some people would also use that in terms of trying to help with a wound, a castration wound or a tail docking wound. But I think the biggest thing, no matter what it is, if you're going to try to, depending on which antibiotic you're using, you need to just determine, are you trying to prevent disease, control disease, or treat disease, and then demonstrate, like I talked about, the need to do that, the benefit of what you're doing, and then continue to reevaluate. I just going to share a couple outside studies, but this one was done in Denmark and presented recently at IPVS. But they showed with an amoxicillin injection, significantly decreased number of umbilical hernias downstream compared to controls, and then also the other treatment group in there was iodine, which showed some effect, but didn't hit the level of statistical significance and numerically higher in most circumstances than the antibiotic injection, and also in one circumstance higher than no treatment. Another study done within the Carthage system presented at ASV looked at control groups versus Exceed or Ceftiofur, long-lasting Ceftiofur injected within the first 16 hours. And in that study, they showed 33% in the controls and 19% naval infections. And then when they followed those pigs down and looked at umbilical hernia prevalence, they saw it was cut by nearly in half, from 4% down to 2.4%. Again, statistically significant for both of those. Up until recently, most of the data we had was looking at one of our multiplication flows and different, either no treatment or different antibiotic treatments, and then looking at umbilical hernia rates. So 1 week they would do, you can see these blue bars are all a week of production with no antibiotic, and then the green bars here would be Exceed, and then these would again be no treatment, and then a couple weeks of ampicillin. And so there was not a single week where a no antibiotic treatment group beat so the lowest no antibiotic treatment group didn't even beat the highest antibiotic treatment group week. So that, until recently, that was kind of the data we had looked at and utilized to justify some of our use. But in context of what Peter Davies talked about when he came down, it kind of spurred us to look at a summer project with an intern, and she's looking at presenting this at ASV too, so I don't want to steal too much of her thunder, but I would like to share a little bit about what we were doing and what our thoughts were. And so what we really wanted to do more than a research trial was to develop a model that we could repeat periodically every 6 months or every year. We haven't defined that 100% yet, but taking a model that we could use within certain sow farms in our system and look in a practical way to say, do we have a need for this? Are we getting a benefit from it? Are we using the right product? And really do something that we can use to continue to reevaluate the need. And in our system, that was using long-lasting Ceftiofur within the first day of age for control of umbilical infections. And so part one of this is basically demonstrating that we do have umbilical infections prior to our treatment. And so what we did was took an alcohol swab, took 10 pigs that had died at that farm that day, no older than 24 hours, so within the time frame of when we would inject them with the antibiotic, and then use an alcohol swab on the outside of the umbilicus, and then a sterile scalpel to cut into the umbilicus, and then swab the inside to look for bacterial growth, and then sensitivity on that. And then part two of this was enrolling 40 litters on 3 different sow farms. So the reason why we used 3 farms is we used one farm sourced by each of our gilt flows that populate our sow farms. And so we had 80 pigs total, 40 treatment, 40 control. And the reason we did that is because we had about 40 crates per farrowing room. And then at weaning, we would take and score those umbilicus on a previously established score of 0 to 5. And then so basically looking at, do we have infections, yes or no? Are the infections susceptible to the drug we're choosing to use, yes or no? And are we seeing benefit in that pig after treatment, yes or no? And so if you look at kind of part one, we did see, again, it's a model we want to be able to replicate and use rather than research type, looking at a large number of animals. But on all 3 farms, we saw consistent 2 or 3 out of 10 pigs with infections prior to birth. And some of those pigs, we had multiple agents. I know we found strep suis, A. suis, E. coli, type B streps, I think also enterococcus, if I remember right out of those. So different antibiotics. Some I would say primary pathogens to a pig, and some would be more of a secondary contamination type pathogen. And then when we looked at the antibiotic sensitivity, what we just put in here was antibiotics that would be available for injection of pigs that would show up on the sensitivity pattern. And you can see 3 kind of stuck out as being the best: Exceed, ampicillin, and enterofloxacin. And so the reason why, so like I said, we were using ceftiofur, and a couple of these looked like they might have a little better efficacy in our system. A couple reasons why we use ceftiofur is, number one, compared to ampicillin. Ampicillin really should be used as a multi-day treatment. It's a time-dependent antibiotic, and so using it as a single injection, question whether that's a judicious use. And also, it's also not labeled for use in pigs. Not that it's illegal to use with a VCPR through AMDUCA. And then enterofloxacin, of course, is not legal to use off-label, which this would be an off-label use. So it's really not, what we would feel, how we're trying to justify it, justifiable. Doesn't mean that there wouldn't be ways that you couldn't, in certain circumstances, justify enterofloxacin use for certain things. But and then part 2 is looking at the benefit to the pig. And so what we saw was basically total percent of infection. We saw a reduction numerically. Severe infections, what we did is basically a score of a 1 or a 2 was either a scab or a red appearance to the navel, so really minimal. And then 3, 4, and 5 would be more of a feeling the hard stump, or pus, or more of a hernia starting to develop. And so we saw a bigger reduction when you looked at severe infections, from 21% to 12%. This is across all 3 farms combined. And then on swollen joints, we saw reduction from 9% of the pigs with no treatment to 1%, and then mortality was the same between the groups. So that's kind of a summary of how we looked at a model we could use, basically with 2 trips to the farm, one day to tag pigs and treat them or not treat them, and another day to go back and score to periodically reevaluate those parameters within our system. Switching gears a little bit to talk about piglet injection of piglets at weaning. And so what I'm talking about here would be a routine injection where we would inject every wean pig for a period of time coming out of a sow farm. And so typically, pretty much almost all the time when we're looking at doing this, what we're trying to target is a herd that's under a severe challenge with an immunosuppressive disease like PRRS, and we're dealing with a lot of secondary bacteria. So we have specific diagnosis of that. So between posting pigs, recording those results, submitting tissues into the diagnostic lab, we're specifically diagnosing those bacterial challenges. And again, that farm's typically going to be under a severe immunosuppressive type of a situation. We always want to be able to measure the benefits downstream when we do that. So between watching our production numbers on those farms, deciding when to pull the trigger to do that, and then also evaluating whether we got a beneficial response from that. And then also having a mechanism for discontinuing. What time are we going to, okay, we broke with PRRS, we're through the worst 2 months, how do the numbers look? What are we seeing downstream? A lot of feedback and discussion on those Monday morning meetings is typically how we're going to go ahead and make the decision to pull back and discontinue that injection. And typically we're going to do it when we expect a better success than a feed or water medication program, typically because it's a time when those pigs are under high stress, they're getting commingled. What we want to do is treat the infections that are already present in the pigs that are infected, and then also control that infection during the time period when those pigs are being commingled out of their pheromone crate and more likely to pass stuff on to the other pigs in the barn. And typically, one other thing I'll say is typically what we usually do is try to use a long-lasting antibiotic. So if we inject those pigs the day before the day of weaning, at the same time we're doing a circle and mycoplasma vaccination, that'll give us an opportunity to treat the infection in the pigs that are infected prior to weaning, but then also control it for that first few days. So usually that's going to be something that's going to be a single dose administration and be present in that pig system. Typically tulathromycin or ceftiofur again, depending on what secondary issues we're seeing. We did a couple field trials looking at, this is done, actually been a couple of years ago now, but looking at those 3 different injectable antibiotics, and we looked at it in 2 different situations. So one of it was a commingled group of 5 sow farms that were testing PRRS negative, but likely had a low prevalence of PRRS circulating, to look at kind of a good, fairly decent health or moderate health type scenario. And in this situation, the control group was about a 3% mortality over 7 weeks in the nursery. And then you can see Exceed, Baytril, and Draxxin all provided, basically cut that mortality by just under half of what it was in the control group. So that would be an example of probably a really mild challenge, probably not necessarily a time where we would use it, but to demonstrate, okay, what does it look like in that type of scenario? And then also look at it in a PRRS positive flow with a really severe challenge, so more on the front end of a PRRS break. And you can see the control group in that situation was 12% mortality in the nursery. And then depending on what treatment we used, again, a lot of times that's dependent on the specific challenge, whether we're challenged more with a disease like strep or more with a disease like more of a respiratory Haemophilus parasuis or something. But you can see that was knocked down with a couple different antibiotics down below to 6% or below, so cut it in half or more. And so we can definitely see in those severe challenges we can make a pretty big impact on the mortality of those pigs by using an injectable antibiotic to the whole group of pigs. And again, one thing to highlight is this had been a group where they were still spot treating pigs. They didn't do no interventions. They just didn't do any mass injection to the piglets. So they'd find a pig after they were sick, treat them, and then that would be their success rate. So again, all 3 choices in our system showed a nice improvement in the pig's health and mortality, good return on investment. So when mortality is elevated due to challenges in the sow source, we do routinely use antibiotic injection for a period of time, and usually that's about 2 months until we get through the worst of that immunosuppressive challenge. And we'll use, again, a combination of record keeping, farm visits, and weekly discussions to make a decision on when we're going to implement that or when we're going to pull that back. And just to highlight one other external, I'm looking at Draxxin use on a really low prevalence, so a 2.5% prevalence group of pigs presented at ASV. So a combination of the mortality and the slower growth rate, just in the amount of pounds sold at the end. Again, 2.5% PRRS prevalence at weaning was over 11-to-1 return on investment. That's just strictly in pounds of pigs based off those healthier pigs growing faster and being alive to make it to market. And then the last thing I'm going to talk about, and I think this is probably the one that would get the least amount of scrutiny in the industry, is using mass injection post-weaning on groups of pigs where they're undergoing a severe health challenge. And so I think this one's easily justified, primarily going to be a treatment for the majority of the pigs in that group, but also controlling infection for the ones not infected. We don't do this real often. It's pretty rare that we have a group that goes through a severe enough challenge that we need to go in and we can't stay ahead of it with spot treatment and water medication. But on average, it's about twice a month, and usually that's either related to APP outbreak, severe hemolytic E. coli challenge. So we're talking when we have about a 1% or greater mortality in a day over a couple-day period. And then also occasionally we'll get a real bad lateral PRRS break where we'll go in with severe fulminant bacteria, and we'll go in and mass treat pigs for that. So those would be the main that would be the main reasons why I would use an injection post weaning. And again, more of a rare type event. But that would really encompass all the situations where we would use potentially mass injection of pigs, both that day 1 type thought process, when we'd use it at weaning, and when we would use it post weaning in our system. And again, I think the main thing, just to drive home, is how do you define whether it's prevention, control, or treatment? How do you demonstrate that within your system? How do you determine that you have a diagnosis? How do you determine that the pigs have a need for it and they're getting a benefit from it? And how are you reevaluating that determine that use is still needed in your system or in your farms you're working with.